I'm Alan Wenzel with Freepod.org, and today I'm pleased to be interviewing Dr. Jack Herrmann, local veterinarian, professor emeritus from the University of Illinois, and a longtime member of the State Board of Health. Welcome, Dr. Herrmann. I wonder if we could begin with you telling us a little bit about your work in public health and how you came to serve on the State Board of Health.
Well, thank you for asking me to chat with you, Alan. As many of the listeners may remember, I was in private practice here in Stephenson County from 1978 to 2003 with Dr. Boyer and Dr. Mason and Dr. Maves and a number of associate veterinarians over the year. I also worked with the Stephenson County Health Department, first with Jeff Todd and then later with Craig Bintema, where I facilitated many community health assessments and analyzed data from that process.
And you've had some additional training in various public health areas. Is that correct?
Yes. After we moved here, I picked up graduate degrees in health policy and epidemiology, also from the University of Illinois, in addition to my veterinary medical degree. And that was all while I was in private practice. The running joke in our family was that Wanda and I would take turns getting additional degrees. So I have master's degrees in health policy and in epidemiology, which is the study of how disease occurs over people, place, and time. And in 2003, I was selected to serve as a Science and Technology Policy Fellow in the U.S. Senate and worked for Illinois Senator Dick Durbin's office as his de facto public health policy advisor.
That must have been quite an experience.
Yeah, it was. As the only veterinarian on the U.S. Senate office staff at the time, and because we had a prion disease bill in development, I became the unofficial expert on mad cow disease when that was a big concern in 2003 and 2004. It was quite an experience to have a Nobel laureate, Dr. Stanley Prusiner, who discovered and named prions, which are transmissible misshapen bits of protein, on speed dial. Additionally, I had environmental toxicants, nutritional supplements, medical devices, and public health workforce issues in my policy portfolio.
What was living in Washington, D.C. like?
Well, I wanted to live in a district as opposed to either Virginia or Maryland to really get the full D.C. experience. So we had an apartment in the Cleveland Park area in Northwest D.C. It's an interesting place. When you work in the federal government in a policy position, it's all politics all day, every day. When I was working in the Senate, the Bush administration continued its party's policy and dismissal of science, and it was a constant battle to scuttle bad legislation that wasn't supported by good evidence. For example, it was in 2003 when the research of Jim Hansen, a preeminent climate scientist for NASA, was censored by the administration because it did not comport with the administration's pro-fossil fuel policies. I grew to appreciate the dedication and professionalism and expertise of so many people who work in the federal agencies.
Did those experiences in Washington, D.C., as working for Dick Durbin, did that lead to your appointment to the State Board of Health?
Well, indirectly. In the spring of 2004, the University of Illinois offered me a faculty position at the College of Veterinary Medicine, which I accepted, and where I taught epidemiology and theriogenology, which is my clinical specialty. It's the clinical specialty within veterinary medicine that deals with animal reproduction. So it's called theriogenology. So clinically, I'm a OBGYN for animals. About 2011, our dean, Dr. Herb Whiteley, who had served on the State Board of Health for quite a while and filled the statutory requirement for a veterinarian on the State Board of Health, asked me to succeed him on the state board, in which I applied to, and I was appointed in 2012 to fill out his term. Our terms are 3 years in length, so I've been appointed by 4 different governors, Blagojevich, and then Quinn, Rauner, and then Pritzker. So I've been on the board for 12 years and currently serve as the vice chair with Karen Phelan as our chair.
That's quite a tenure on the State Board of Health. Can you tell us a little bit, Dr. Herrmann, what the State Board of Health does?
Well, the State Board of Health dates all the way back to 1877 and serves to advise the Department of Public Health through needs assessment, developing statewide health objectives, policy development, and assurance of access to necessary services for people in Illinois. One of our major functions is to provide oversight to the rulemaking process.
What exactly is the oversight process?
Well, when a law is adopted or amended, the legal team at the department puts those changes into legislative language. And then we on the State Board of Health review the changes and make sure that they make sense, not only from a scientific and social standpoint, but also that they reflect the intent of the changes. Basically, it's here's a change that the General Assembly thought was needed, and now we have to write the rules to make it work.
You mentioned statewide health objectives. How does the board work with the Department of Public Health to develop those?
Well, by statute, the department has to do a state health assessment, which is under the acronym SHA, S-H-A, and then produce a state health improvement plan. So every 4 years. And so it's the output from that process that describes the health priorities for the state. I was honored to be appointed by Governor Blagojevich to serve on the first SHIP, or State Health Improvement Plan, committee back in 2004, so I'm pretty familiar with the process.
When was the most recent iteration of this state health assessment, and what did it identify as the health priorities?
Well, the most recent State Health Improvement Plan, or SHIP, was completed in 21-22 and focuses on 4 major priorities and a number of overarching themes that apply to all 4 of those major priorities. The 4 priorities are chronic diseases, mental health and substance abuse, maternal and child health, and of course the coronavirus pandemic, because it was running hot during that SHIP process. The overarching themes that apply to all those priorities are health disparities, access to health care for all citizens, and the health impacts of climate change.
I'd like to talk about chronic diseases for a second. I've often wondered, Dr. Herrmann, what exactly qualifies as a chronic disease? What are we talking about here?
Well, chronic diseases are not only one of the greatest burdens on quality of life as we age, but also a major cause of premature death and disability. Most are associated with lifestyle choices and environmental exposures.
Such as?
Well, smoking for one. I think I remember seeing recently that we still have about 15% of Illinoisans who smoke regularly, a number that's been further impacted with the recent development of vaping. The prevalence of obesity and physical inactivity was called the pandemic before the recent coronavirus pandemic. About 70% of Illinoisans are either overweight or obese. And those are associated with an increased incidence of type 2 diabetes, cardiovascular disease, stroke, cancers of many types, early cognitive decline, and many other conditions.
I noticed, Dr. Herrmann, that you often say associated with. Can you explain exactly what that means?
Well, yes, in epidemiology, we talk about the associations between an exposure and an outcome. Associations or correlations do not equate to causality. They just say that if we're exposed to this, the risk of developing that happening is statistically significant or not. It's only when we can develop a more mechanistic explanation through hard bench science that we can approach causality. An example is in the 1950s when Sir Dahl and Hill noticed a strong association between cigarette smoking and lung cancer in British physicians. It wasn't until years later that the work on the cellular level proved indeed that cigarettes were causing lung cancer.
Can you tell us a little bit more about what else came out of the latest health improvement plan?
Well, we still have a problem in Illinois and nationally with maternal mortality, low birth weight babies, and premature deliveries, which is also a health disparity issue as well, because women most affected are Black African American. Nationally, non-Hispanic Black women have a maternal mortality rate about 2.5 times higher than non-Hispanic white women and other racial ethnic groups. The numbers are coming down, but there's still much work to be done, and it's tough work. There's pretty good evidence that chronic stress associated with discrimination and racism is at play here.
Dr. Herrmann, earlier you mentioned the health impacts of climate change. I wonder if you could talk to us a little bit. Exactly how does climate change impact health?
Wow, how much time do we have here? Let's just start a list. increased air pollution, heat, humidity, increased pollen production, and the antigenicity or the allergenicity of pollen, the ability to induce an allergic response, asthma, extreme heat, and inability to provide enough cooling centers, especially for older people, increase in severe weather like floods and tornadoes, hurricanes, drought, changes in the vector host dynamic in tick-borne diseases such as Lyme disease and Rocky Mountain spotted fever, et cetera, water quality degradation, higher bacterial levels in water, harmful algal blooms that we see, especially in this area. The list goes on, and they're all One Health issues.
Can you tell us what that means? One Health, these are all One Health issues. What does that mean?
Well, One Health is the understanding that human, animal, and ecosystem health are all inextricably related, and that you can't have the health of one without the health of the other two.
It makes a lot of sense.
Yeah, and the One Health concept goes all the way back to the development of germ theory with Louis Pasteur and Robert Koch back in the 1860s. It's not a new concept at all, and also why veterinarians have been on the forefront of public health for over 100 years. You know, approximately 70% of pathogens, whether they're bacteria or viruses or protozoa or parasites, are transmissible between people and animals, and veterinarians are right in the middle of that mix.
Well, I didn't realize the percent was that high, 70%. That's fascinating. You know, we could talk for a long time, Dr. Herrmann, about all of these issues. But before we wrap up, I wondered if we could just talk a little bit about some of the issues that we might be facing locally, and maybe even some of the hot public health issues nationally that are in the news. Could you talk a little bit about a couple of those for us?
Well, the coronavirus is still active, so we got to keep that in mind. It keeps on mutating, and we keep on getting different variants. And, we may have cross protection from previous exposure and previous vaccination, but it's hard to tell. So always keep that in mind. Coronavirus is always in the background. Also, measles has made a comeback, unfortunately, to decreasing levels of childhood vaccination rates. So far in 2024, so only, 5 months into the year in Illinois, we've had 67 cases of measles. Compare that to 38 cases in the previous 9 years. So we've almost doubled our previous 9-year case count for measles. It seems that we need to remind people every generation that vaccines save lives and prevent often lifelong disability, like with polio. I bet that you remember kids in your grade school who used to have leg braces as a result from a previous polio infection.
Yeah, I do. And I also remember getting measles as a kid. But Dr. Herrmann, I also remember not too long ago, we thought we had eradicated measles for good, but now it's making a comeback.
Yeah, I'm really afraid that measles and polio both, because of declining vaccination uptake, is going to be an ongoing problem as we move forward.
Could you talk about a couple of other issues that we might be interested in knowing more about, local public health issues, Dr. Herrmann?
Yeah, locally, I just wrote an article about PFAS chemicals in water and was happy to report the Freeport water is safe from those PFAS chemicals, which are called forever chemicals.
Forever chemicals.
Yep, they're per and polyfluoroalkyl substances. PFAS is the acronym PFAS. It's a diverse group of thousands of chemicals used in hundreds of different types of products. PFAS in the environment can enter our food supply through plants and animals grown and raised and processed in contaminated areas. And it's also possible for very small amounts of PFAS to enter food through food packaging, processing, and cookware. Luckily, through forward thinking and planning, Freeport water supply has tested negative for PFAS since the new well was brought online. The two old wells, which tested positive for PFAS, but at levels barely above the actionable levels in the past, were retired from service a few years ago. It's a testimonial to the beneficial health impacts of progressive thinking and using science to inform policymaking.
That's very reassuring news and information for those of us who live in Freeport and may drink city water. Let me change subjects to another topic that's in the news, Dr. Herrmann. Bird flu and dairy cows and milk. Can you talk a little bit more about what I'm reading about and help me understand that issue a little better?
Yeah, dairy is an important part of our county's economy, and it was an industry in which I worked and loved for many years. My wife grew up on a dairy farm by Rock City, and so the stories about finding bird flu particles in pasteurized milk piqued my interest. We've been dealing with bird flu outbreaks forever, it seems, and the most recent one with a virus called H5N1 started a couple of years ago. When it showed up in a dairy worker, I think it was in Texas a few months ago, researchers started looking to see if dairy cattle were being infected as well. They found an immune response among dairy cattle that were tested, suggesting that they were being infected, but not necessarily clinically ill. And then the FDA and others started testing pasteurized milk in a sample of grocery stores and found bits of virus in the milk. I need to stress, though, that these were non-infectious bits of virus that were only found through a process called PCR, or polymerase chain reaction, which is a process that amplifies any genetic material, DNA, found in a sample. So the key point, though, the take-home point, is that the pasteurization process worked as it was intended, and the nation's milk and cheese and yogurt and ice cream, all that supply is safe. Consumers don't have anything to worry about pasteurized products.
Boy, that is really good to know. One of the items that I hear about every once in a while are those folks who advocate drinking raw milk. What about raw milk?
Well, that's a different story. When the pasteurized milk ordinance was passed back in the 1920s, the number of milk-borne illnesses dropped dramatically. The bacteria that caused tuberculosis and brucellosis was transmitted through milk to humans routinely back then. A combination of mandatory pasteurization of milk and testing of cattle for both diseases led to essentially the elimination of the milk transmission of both diseases. But there's many other diseases that can be transmitted by unpasteurized milk, so we must always stress the importance of pasteurization. Pasteurization works, and it doesn't affect the quality of milk in any way. Despite what advocates of raw dairy products say, there's absolutely no science-based reason to consume raw, unpasteurized dairy products. Some of my colleagues at the U of I are currently ramping up a study to look at the prevalence, if any, of H5N1 flu virus in Illinois dairy herds. It'll be interesting to see what they find. It may be that cattle have been infected with bird flu virus in the past and showing no symptoms for years, but we won't know that because we never thought to test them.
Dr. Herrmann, we've covered a lot of ground in the last 20 minutes. I want to thank you for your time and for sharing important information about Illinois' health priorities and the health issues that touch all of us either directly or indirectly right here in Stephenson County, including issues such as chronic diseases and the climate change-related health issues that you mentioned. And I'm sure our listeners appreciate your reassurances about the absence of forever chemicals in Freeport's water supply and the safety of our nation's milk supply. Thank you, Dr. Herrmann.
Well, thank you, Alan. It's always a pleasure to chat, especially about important issues in public health.
Well, we'll stay in touch, and we'll have to do this again. This is Alan Wenzel for Freepod.org, reminding you to check us out for the local news you may have been missing.